Welcome to Tales of Hope, where every paw print counts. Animal tie in the house, spreading love, hear the sounds. Every week animal stories, rights and welfare in the mix. Step up, take action, we're giving animals a fix. Tales of Hope, raise your voice, make some noise. Change the game for every animal, girl and boy. One world, one fight, let's turn the page. A future for the voiceless, bring hope to center stage.
Ladies and gentlemen, today we have a very wonderful guest on our show. We have Dr. Ceri Lewis Moore all the way from UK, and we're going to let her introduce herself.
Hi there, I'm Ceri. So I am a UK graduate from Nottingham Vet School. I've been in practice now about 14 years this year, just coming up the anniversary. I'm a small animal practitioner currently. I have historically been both a mixed and a large animal vet. I'm very first opinion. I'm a GP vet pretty much. I try to do the best I can in the circumstances, and I've generally practiced in pretty rural areas in both Wales and Shropshire in England. And goes with that, you know, they're not the richest areas in the world, but it's still good. There's still good veterinary care there, so it's all good.
So that's where we're going to come with our first question. How do you approach conversations with client when their budget constraint limits treatment options?
Yeah, so this, I think this question is pretty much something that I have to deal with on a daily basis in my job. You know, we aren't the richest community. We have, depending on which bit of Shropshire I have worked in, there have been a high proportion of clients who have been insured. But unfortunately, the way it goes at the moment is that practices are limited into which insurance companies they're willing to do direct claims with. Okay, which means that clients still do need a little bit of a fund or a possibility of being able to afford, you know, upfront costs. So there are still financial constraints even if clients are insured. There are, you know, mechanisms that can be, that's my internet being rubbish, sorry. There are mechanisms that can be sort of employed to help with that, but it is a conversation, you know. Unfortunately, in the UK, we don't have an NHS, you know, it's a private healthcare system for animals. So when people do have pets or horses or cattle or sheep, you know, any animal that they are responsible for, there is a financial commitment to that. So circumstances can change. They can have an animal where, you know, they were in a good financial position when they obtained it, or they were given an animal they weren't expecting to be, you know, given, you know, if an elderly relative dies or circumstances change, they take on an animal. And these animals, you know, at times do need veterinary care, which is expensive. So my approach is always to be, I'm quite direct, it's who I am anyway. I sort of feel like if you have a direct, open conversation with people, and encourage a dialogue about, you know, be honest, what is your budget? What are your circumstances? And you don't have to tell me the detail, but I need to have some idea about where the situation is financially, because there are options, okay? There are, you know, and I don't really like to call it this, the gold standard or the ideal. Yes, there's always an ideal option, but often that requires, you know, financial backing. You know, investigation is expensive, treatment is expensive, but you can do things on a budget. But I can't create, and I try and say this to people, that, you know, there's no judgment here. You know, you might have the finances, I don't know, it's not my position to know, but I need to have some idea about where I can go with this case. You know, how much are we able to investigate with diagnostic imaging or laboratory work or whatever. And if we don't have that, you know, luxury, then I need to be able to plan and within your, you know, your budget. And I think if you can be open, be honest, explain to the client that you're not there to just spend all their money. You know, the reason I ask is, you know, are you insured or how much do you want to spend? It's not because I then want to go and spend it all. I just need to be aware of which treatment plan, which investigation plan that I can look towards, and then, you know, tailor it for that. I would always offer everything, but I would always then qualify with that, you know, this is ideal if we could. This is the plan that we would do to investigate and treat if we can, if money allows, that's fine. And this is if we don't have that money, we can still treat, we can still make a plan. And there's all shades in between, and we can do all of it. And I just need an awareness about where we can be on that scale. And it is just, you know, sometimes people, I would never ever prejudge someone on what they look like or where they came in, or, you know, because you don't know. And that's why I say to people, I don't know your circumstances, and you need to, you know, as much as you can, make me aware of what I'm looking at budget-wise, because stuff can be done. And I never try and guilt trip people ever. I just need them to be as honest as they can be with me so that I can help as best I can. And I think if you go at it like that, people will often, you know, either say, no, I'm not interested, and that's fine, you can't help those people. But people often, I find, the conversations that I have, they will open up a little bit, because I'm not there to judge, I'm there to help, and I will try and get that across anyway.
I think, you know, from what I heard from your side, I think it's a two-way street, where the client, you know, the client also needs to come up front and be honest about his financials, so that the animal is taken care properly, you know, within the budget that is available. Now,
yeah, and I'd hate that, you know, I would never try and make a client feel that if they're not doing, you know, the ideal, that they're doing a bad job, because it's just not the case. You can still offer an animal good care if it's not ideal. It's you know, it's still possible to give good care to an animal, even if the circumstances are not ideal. You know, I think I'm sort of jumping a little bit, but as veterinarians, we are, you know, we're there to piece together a puzzle, and we are there as an animals advocate. So I have had conversations previously where I've explained, you know, that a pet has got now a medical condition, which will be long-term, lifelong in fact, and the treatment, unfortunately, say heart disease, it's a progressive illness. It's an expensive illness to treat. I can go on my findings, my clinical findings that I can do in the consultation room, together with the history that the client's provided. Yes, in an ideal world, we would do a heart scan. We do other investigations, we do some blood work, we do this, we do that. But I can go, you know, as a vet of my years qualified, and even new grads can do this. It's what we're taught at vet school. Go on the clinical signs, go on your physical examination and the history and signalment. So that means like the breed of the dog or cat or whatever, and you can offer trial treatments. Okay, and you don't have to investigate if you aren't able to financially. You can trial treatments, and that's still an investigation. You know, if something improves because you've given it a medication because you have a strong suspicion that this is the case. But I always will make clients aware that I'm doing it, you know, it's not a best guess, but it's using the information that I have available to me right now to provide a treatment plan within budget. And it's not a bad thing, it's just I don't have a crystal ball. That's why we have investigation, because that's how you get diagnoses, but it's not always possible. I literally had this last week because it was a Chihuahua. It was 10. It had a murmur, a cardiac murmur, and this breed, age, specific scenario of the history, etc., is mitral valve disease. Okay, now, yeah, I could be wrong. It might not be, but best, you know, all of that information, given my experience and my training, I can say, look, yes, I would like to investigate. I'd love it if we could. I could do this, that, and the other. But it's expensive, and actually the treatment's expensive. So if you are on a limited budget, it's multiple medications. But let's give it a go for 2 weeks. Let's see if it works, and if it works, then fine, we'll keep going. We can always go back if you get some money or whatever, if the circumstances change. We can always go back and confirm our diagnosis. But I find it tricky because I've only ever worked in first opinion. I have worked in out of hours in a hospital setting, but I've never been in a hospital. I've always worked in first opinion practice, and so I do have to do this. I can't. By the time things get to hospital or referral, it's because clients are either hugely invested, have a financial budget that can go with it, or they're insured. But I often, as a first opinion vet, I don't have that luxury, and I still need to treat my patients. And I think that's, it's always a compromise. It's always a compromise if finances aren't freely available. But it doesn't mean that it has to be poor treatment. It's just not a thing. And I would always say that to clients. There is ideal and then there is reality. And it's about having that conversation and making them aware. That's the biggest thing, is being aware that if I don't have all the information, I have to, use what I've got. And I can't, and sometimes that is really, really hard, because clients, sometimes, and I get it, I understand, they want all the answers without the investigation. And that's not always possible.
Absolutely.
It's really not, but they want it, because why wouldn't you? I want to know now. But it's medicine, especially, does not work like that. If you've got a broken bone, fine. You'd be like, yes, it's broken. Look, ping ping. I don't need an X-ray. I mean, you do, but you could give them a diagnosis there and then. But medicine, internal medicine, whatever, is different. There is a reason that there is investigation, and that's because different medical conditions can look similar even if they're not the same. And that's why we have investigations. That's why it's not just to spend people's money, it's to rule things in and rule things out. And sadly, it's not always possible. So we do just have to go on our experience, but it's having that conversation and making clients aware that, I could be wrong. I could be wrong. That's life, because I don't have all the information. So, it's a little bit self-protective, if I'm honest, because in this day and age, clients will complain, if you get it wrong and whatever. But I always have this conversation with people. If I can't have all the information because of the budget, whatever, or the animal isn't tolerant of it or whatever, because it's not always about money. Sometimes it's what the animal will tolerate. Then I have to go on what I've got, and that's the key. It's what information I have right now in front of me that I have to go on, and I could be wrong if I don't have all the answers. It's that conversation. It's got to be.
Absolutely. Taking this further, Ceri, what strategies can help maintain animal welfare when ideal treatments aren't financially feasible?
So I guess it's kind of what I've discussed already. It's things like child treatment. It's things like, I always tend to say, look at the animal. They can't talk to us. Go on the clinical picture. Now, that's not always easy if it's something that's a very subtle condition, but that you always come back to the animal, because if I've diagnosed something and this medication is meant to help and it's not helping, well, okay, I don't necessarily know why it's not helping, but I'm looking at the clinical picture and I'm saying, right, something's got to change. So I guess that's sort of one way of doing it. And also asking for opinions from, I put a post on recently, I think on LinkedIn, and it was about a case that, I'm not an orthopedic person. I'm a GP. I don't like chopping bones. And I asked, on LinkedIn, and I asked people who are experts. So as a GP, for me, I do go and ask questions of referral people as a way of educating myself, and also to obtain information that I can then pass on to my clients without having to make formal referrals. I mean, it does then mean that if I do have clients, there's got to be some give and take here for the referral vets. It does then mean that when they do have if you get helpful information back, even if you're not referring a client, it's a two-way street with me and a referral vet, because I will then send other cases to them. So there is a benefit to giving free information, as it were, but it does help a client that doesn't have the budget, and it educates me. educates me as a GP vet. So that's kind of, I suppose it's thinking outside the box a little bit, using your clinical picture, using your resources, whether that's be information, in a textbook or information from another, colleague or a referring vet that's helpful.
Absolutely. It's always helpful, when you can get the information from people from your same field, and because everybody has different cases and different fields to specialize in.
Yeah, and even if it's not specialism, just chatting to other colleagues, I'm fortunate in that I because I've locumed quite a lot, and also I attended 2 vet schools, I do know quite a lot of other vets. I'm quite, I do know a lot of people, so I do tend, and I'm cheeky, so I do tend to just get in contact and be like, help me, please. And talk it through, because you don't have to be a specialist to have seen something before, and for a treatment that you maybe have been in the same situation has worked. I've done the same for my colleagues. If they've had something, they're like, yeah, referral's not an option, the budget's really limited. What have you had this before? And I go, oh, actually, I have had this before, and this is what I did, and it worked in that case. It might not work in your, it's sharing information, knowledge sharing, and you do that with the client as well. And I always try and do that. I really do try and educate the clients. I'm not there just to be like, yeah, look at me, I know it all. I always, and it's a running joke in my work, as me as a practitioner, I always have scrap pieces of paper in my room. I always give clients homework.
Wow.
Because that helps me. because if I can educate the clients, they can come back to me with, they can almost, I'm not teaching them to be vets, but I'm teaching them to look for signs that will be helpful to me as a vet. They might not think it's significant, but if I can give them some information of things to look out for, like this dog with heart disease, exercise intolerance, panting, changes in the breathing pattern, they're not necessarily going to understand the relevance of it. But if I can give them information as to why it's important, they can, they potentially will come back to me sooner when I can do something about it. So, yeah, educating yourself as a professional is helpful, but I would always share it, pass it on, whoever, doesn't really, colleagues, clients, whatever, share what you have.
Absolutely. Sometimes it is sharing is what is caring is all about.
Yeah.
So, that's where we're going to come to the next, taking it further would be, can you share experiences where financial limitations led to creative or alternate treatment plans?
Yeah, I mean, it's hard to pick one example really, because it's kind of, like I say, my everyday job is working with a budget. So there are, I suppose there's one, well, I honestly, there's so many, I'm not sure I could pick one. It is the client who can't, investigate the animals. It is sort of, talking to your colleagues. It is learning. It is, I'm not an orthopedic person, but I have sort of trialed, in my past, where we've tried sort of, creating supports, out of guttering, like for little teeny tiny animals. We've tried to do sort of like splinting out of certain household goods. There's no one example that I could really give you where it's sort of, a great example, because it's all the time. You're always trying to do it. You're always trying to think outside the box, trying to fit in, or at least that's my experience of practice anyway. That sort of thing. Yeah,
well, since you mentioned everything, that it's expensive, and as vets, I guess with pet parents, sometimes you need to get creative. That's what I guess. That's the part and parcel of your profession, I guess.
Yeah, and I think as well is that, just thinking about pet parents, part of the reason that I educate clients is because they are with their animal all the time.
Yes.
Or, pretty much. And they sometimes come up with ideas, honestly, I've had clients come in and go, do you know what? I've been thinking about this, and I looked at the information that you gave me, and I'm gonna do this, and I go, oh, that's a brilliant idea. You know, it could even be as so, you know, and it could be anything. I can't really think of specifics. Usually, it's like chronic illnesses, because you know we all get frustrated with chronic illnesses or things that won't heal, and you're like, why is this? Why can't we stop this? Why can't we, you know, like wounds that are in a really awkward place that you can't successfully prevent the animal getting to, and it's not going to heal if the animal doesn't stop chewing at it or rubbing at, you know, it's working with your clients often, because if you work with a client, the compliance is better, you know, and you're all working towards a shared goal as far as I'm concerned, which is to make the animal better. That's why they've come to you in the first place. So it is working with your clients. They are your clients, but you're both working, hopefully, towards a shared goal, which is to look after the animal. Absolutely. You know, sometimes that can be conflicting. You know, sometimes it can be conflicting, because as a vet, as a professional, I will have this is my perspective on it, and this is why I feel that your animal's doing this. And it's tricky when behaviour is involved, because animal behaviour is actually quite an in-depth subject. You know, there are specialisms in it, and sometimes I've found it difficult sometimes when owners project emotions or their own ideas of why the animal's doing this onto the animal. It then makes it different, because you're coming at this one animal in the middle from different perspectives, and then trying to explain potentially to an owner that's not why the animal's doing it, it's actually this behaviour shows this, and they won't have it. That's when it can be tricky.
Absolutely.
But then you're not working together, so that's what the bit that you have to fix then is you know, you've got to go with the client on this. You know, you have to work together, and even if that means that you have to spend time to explain things, that's fine to a client, but you've got to have them on board, and sometimes it's not possible, and that's when you go, do you know what, I'm not sure that I'm getting through. And it doesn't have to be a bad thing, but I would always say that, you know, if I'm not sure if I'm coming across well, or if I'm just not getting the client on board, and I'm out of ideas about, you know, how to convey what I'm trying to say in a way that's understandable, then I would say maybe talk to a colleague, because it does get to a point where if you've been dealing with a case and it's frustrating because you're not progressing or the compliance is poor and you don't, you know, I've certainly been at a point where I've been like, I'm not achieving anything here. So, and I've said to clients, you know, maybe it'd be a good idea you speak to another vet, because they've experienced different things. They might be able to, in my head, that vet might then be able to talk to that client in a way that I haven't been able to, you know, and that's I'm not precious about things like that. I'm absolutely not. And you know, at the end of the day, if it will help the animal, that's what I'm about. I'm not precious about anything like that. I'm really not. And I don't think it's a bad thing that if a client wants a second opinion, it doesn't necessarily be a bad thing.
Yeah, I think that's very rightly you said. You know, it's like not holding on over the ego and saying, no, I am going to take care of it. Sometimes it's not us. It's just that the client is a bit, you know, sometimes it may be the client is a bit of thickhead.
I mean, it could just be, well, I'm not going to say anything of that, but it could just be, you know, sometimes, you know, like veterinary is a public facing role, okay? It is, and we are educated and we know about science and biology and chemistry and all the rest of it, but there's on top of all that is the animal that can't talk to you, okay? So that's fine. You have to read behaviours, and I'll be honest, I do feel that sometimes, I mean, if I'm not an exotics vet, I'm just not. It's nothing I've ever had anything to do with. So if I had to look at a gecko and look at its an environment, I would not be the right person for that, because I don't really know what a normal gecko should look like. I don't know.
Absolutely.
And that, you know, I just don't. So, but I do feel that I'm really good at like dog and cat behaviour. And for me, I've also done equine horses and farm animal as well. Okay, but I've certainly had conversations with colleagues where subtle signs have been missed because they've not been able to read the behaviour, or that their perspective is skewed because they had one case that did this. And we can all do that. But clients can be led by their personal experience as well. So sometimes it is just the fact that you just come into loggerheads, and I'm always at the point where I go, do you know what? It's not working. Let's try something different. Let's let somebody else have a conversation here, because I'm not getting anywhere, and all that's happening is we're all getting frustrated. We're not progressing with the case. Let's switch it up, move on, for the animal. And that is what I would always say. And again, that's why I'm not precious, because it's not about me. It's not about me.
Absolutely. Moving forward, how do you communicate the value of preventive care to clients concerned about cost?
So, I mean, really, in an ideal world, veterinary medicine is about prevention. It's so much better. This is what I say to clients. The reason we have preventative healthcare like vaccinations, or neutering is a tricky subject I don't want to get into too deeply, but essentially, if you neuter an animal, if you spay a bitch, or you take the uterus away, they're not going to get a post-season infection. They're not going to get something called a pyometra, which is an infected womb after being in season. So that's technically preventative. But there are I would always say to clients, it's far better and cheaper to prevent an illness, also for the animal welfare. We would rather prevent illness if we can. So first of all, ethically, I think we should prevent things that we can with vaccinations, etc., worming, flea treatment, blah, blah, blah. Then actually just treat it when it becomes a problem. Because usually when something's become a problem, one, it's more expensive, two, there's been a compromise in animal welfare, and three, it's harder to treat. So let's just stop before we start, as it were. Do you know what I mean? And I think if you sell it like that, depending on the client, so it depends on the client and what they're most. I'd like to think that for a client, their animal welfare is their main priority, above everything. But for some clients, it is financial. So if you can sell it on both ways, it's better for animal welfare, but it's also better financially to prevent, then that's a way of getting everybody, isn't it?
I think as pet owners, because I have 3 myself, and I think my priority is the welfare and the well-being of my kids, of my furry kids, rather than it's okay. At times, yes, even in India, it's quite expensive if you have the right doctors or the right vets. It's no longer cheaper, because I can give you an example of one of the fur babies that we have when we rescued her. And she was just like, about 3 or 4 months old. We had to really, take care, even though we had the insurance and everything, but it did put a big dent into our pockets, because for us, the furry kid's life was more important than money. Sometimes it depends on how you look at it, even as a pet 100%. Parent.
Yeah, and I think you're absolutely right, because I guess it comes, it's what motivates you as an individual, isn't it? So, and I see this because my client base is quite varied. So we have, where I practice, so we have your classic pet parents like yourselves. You don't have human 2-legged children. I mean, I include this in me. I do have 2-legged children, but I also have my 4-legged children, and I don't joke when I say that my Labrador is my favourite child. I really don't. I don't, and yet I am meant to be like a sensible professional. you've got people like us, okay, but you've also got the you've got professional pet or slash animal owners. Okay, so you've got your farmers, you've got your let's say racehorse trainers. Okay, so it's about where you're coming from, because you even and I don't mean to classify farmers in one group to say no, they don't care, because that's not true. That is not true. There are farmers who I have had absolutely distraught, crying their eyes out because the cat's been run over, or they've had to put their really elderly dog down, and just because they're farmers doesn't mean they're heartless. Do you know what I mean? But sometimes there are factors, specifically pets. They do tend to be more emotionally attached. Often they're in the house. Often they're in people's beds. Whereas farm animals often are production animals, and therefore, unfortunately for that animal, and I'm not saying this is every time, but there does tend to be more of a financial consideration for that.
Absolutely.
Okay, so but it doesn't mean that they have to get poor care. That's the different conversations, but it will influence what money is, what people want to spend, and it's the same, unfortunately, with small furries like rabbits and hamsters. There are limitations in what you can do for a start, medicine wise or whatever, and also physically giving treatment to teeny tiny things is really quite difficult. But it's also the financial side of it, compared, and I hate this, and I'm not saying that this is an okay conversation, but clients have said to me before, yeah, but the hamster only costs like 25 quid, I'm not spending 150 on treating it, and that's fine. I mean, if you ask the 5-year-old child who it belongs to, they wouldn't say that was, the financial stuff was at all relevant, but unfortunately it is relevant for that pet parent who is the parent. Do you know what I mean? So it's tricky, and it's tricky, and it's always a conversation. It's always individuals. You can't ever have in your head, right, this is a farmer, he's bringing in a dog, she's bringing in a dog, they're not going to want to spend any money, because that's not true. You can't prejudge any of it.
Absolutely.
That's not how it is. It can't be.
No, it's absolutely rightly said. We're not here to judge anybody, but I guess at the end of the day, it also boils down to your emotional connect with the four-legged.
Absolutely.
It's more of the emotional connect that you have with the four-legged.
Yeah, and that will then, if you are hugely emotionally connected with an animal, you're gonna want to you're gonna want to do something. You're gonna want to give that the best care you can. Look at I see people who are, they've got no money, but then they set up like GoFundMe or whatever it is, these like pages where they try to ask for help. And I get it. I understand why. And it's tricky. Unfortunately, there is. Yeah, it's hard, but that's why we do it.
This can be a very long debate. We can be really talking about it, and it is something that which affects every pet parent. As what I call them. Moving forward, what role do you think the pet insurance and wellness plays bridging the gap when it comes to affordability?
Yeah, so obviously with insurance, there's I feel like this could be a whole podcast in itself. But insurance, there are, I suppose, like any insurance, there are different policies there that cover different things, and there is no one set policy. And it's got even more complicated now. I think that there are so many insurance companies out there that they all have different policies, they all have different small print, and I have absolutely been on the receiving end of this, where it's been out of hours, or it's generally out of hours because it's an emergency. So clients have come in and they're like, yeah, we're insured to like £7,000, and just go for it, just do what you can, and and you go, okay, brilliant, because again, medical planning pattern, whatever, you go, right, okay, great, I've got this budget, this is what I'm going to do, that means I can do this test, this, we can hospitalise, we can do this, we can do that, because you've been told you've got a budget of blah blah blah, so you run with it. And then I've being at the receiving end of the client, we've, you know, already gone with it, given the best treatment we can in the budget, and then the clients come back the next day after I've suggested, before we go for the MRI or CT or whatever, that they double check their policy and they look at the small print, and then they've come back horrified because they've realised that the policy that they've taken out does not cover for blah 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 up to blah blah. You know, and it's awful. Honestly, it's so awful, and they're devastated. And I'm thinking, well, I'm really sorry, but that's not. It's not on me, and I'm sorry that I'm the one that's got you to check. But isn't it good what we found out now? You know, so I am always, if a client tells me that they're insured, brilliant. But I would always suggest that if it's a planned procedure, that they go and check their small print, or they email the practice, you know, the policy, so that we can check it for them. Because insurance, I'm not gonna like slight insurance companies, but insurance companies will wiggle out of paying stuff if they really don't need to or want to, and that's the same with all insurance, car insurance, house insurance, whatever. So you've got to check your policy. I would always recommend having insurance if possible. I'm a vet. Both of my dogs are insured because I don't do orthopedics. You know, so if my dog got run over, I couldn't sort that. I mean, I could do the like pain relief and stabilise, but I couldn't fix the bones, and I can't afford. You know, veterinary care is expensive. You know, my own dog wasn't insured by old terrier, and she got she was only 7, and she got a cataract in her eye. Now, even mates rates, okay, I'm not an eye specialist, I got the cataract removed and a false lens put in, and even mates rates, it still cost me about £3,000 all in, you know.
Wow.
Now, yeah, so it's expensive, right? And I'm a vet and I insure my animals, so I would always tell people that. But insurance, there's different policies, there's different costs, and it's different for every breed. So if you've gone and bought yourself a French bulldog that are known to have breathing issues, they're known to have skin issues, your insurance will be higher than my crossbreed puppy that is like a mongrel, basically, you know. So it's not as straightforward as going, I've got insurance, I'm fine. It's really not. So if people, and it is expensive, you know, I know clients who have spent £200 a month on their insurance because of the breed that they've got and because of, you know, the conditions that they've got, and it gets more expensive as they get older. So I would always have a conversation about insurance, but for clients who say don't have £200 to spend every month on insurance that they might not need, that's fine, but they need to start having a backup plan. You know, if I had a cushion of say £7,000, which is what my insurance is covered for, okay, if I had that cushion, I would be putting my money that I pay each month into a bank account, because my dogs are currently young and don't have any issues, and then that's my money at the end. And that's another way of doing it, is have a pot for your pets that you put money in every month. The problem is if you don't get to build your pot of money because something happens in the meantime, so that you've only say had a year of putting, I don't know, £50 a month in, okay, well, that's, you've only got that much in your pot, and you have to have a cushion then that will go on top of that. So it, you know, financial commitment to a pet is there regardless, and it should be one of the things that people, if they can, consider before getting an animal. It really should be, because it's essential. You know, you've got to be able to feed it, you've got to be able to look after it properly, and that includes, like you say, preventative healthcare. You need to have something in place that if something goes wrong, you are going to have to pay for it, and unfortunately that is just the way it is. And medical care, veterinary care, you know, human and animal, is expensive, and it's just the way it is.
I think I have had the first-hand experience for this, so I am not going to get into it. But whether insurance or not, I think you know, what you mentioned is having a pot. I think that's an excellent idea. You know, I think people listening and pet owners should actually consider, not only consider, but this is something they should have as a contingency plan for themselves.
Absolutely. Absolutely. And you know, and I'm not going to downgrade the importance of having a pet. I'm absolutely not. You know, I would never be without my dogs. Okay, ever. I've never been without a dog. Even at uni, I had a dog. Okay, because for me, it makes me happy, and I've been through some stuff that actually I need that in my life. So I would never say to somebody, you know, you can't have a pet because you don't have any money. But maybe they should delay getting one themselves until they do have the money. You know, when I was at uni, there was a period of time where I couldn't have my dog in my student house. Okay, I wasn't allowed. But I used to absolutely, I missed having that. So I used to go and volunteer at Dogs Trust or whatever, Dogs Home or a rescue centre, because that way they weren't my financial responsibility. I got to spend time with dogs, or well, it was generally dogs, but who needed companionship. I needed companionship, and it was a way of getting that interaction that is beneficial for both of you. So I really would rather somebody that didn't have the financial backing, as it were, to get their own pet, but wants that animal connection. Please just don't necessarily go and get a puppy because you can afford 400 quid right now, because you've got to be able to look after it. So please just go and volunteer at a rescue centre or do something. I'm not saying that people who don't have money can't have that connection, but you can get it in different ways, and ways that are, you know, are not detrimental to you as an individual that have to spend lots of money on something that's been unexpected but has to happen because your animal is suffering. But two, you know, that you don't then, and this has happened to me, guilt trip your vet for charging for something that has to be charged for, because that's not on me.
Absolutely.
That's not on me, and it's really not. And I've had this multiple, almost, oh my God, not even just in my job. I've had people talk to me, just random strangers talk to me in a pub, that tell me that it's disgusting that vets charge money. Well, and I'm like, well, dude, you're a builder. Is it disgusting that you built me a wall and charged me a wall, and I needed that wall to stop my kids getting run over? You know, it's not the same. You know, I'm emotionally invested in my wall. It means that my dogs and my kids won't get run over. So why are you charging me? You can't say that to a vet. It's not okay. You know, you as an individual pet owner have a responsibility to care for your animal, and sadly that costs money. Everything costs money these days.
Absolutely.
It's not just vet, and it does upset me, and I'm not the only vet that this has happened to. It's upsetting as a profession that people will say that if you cared, you wouldn't charge me money. No, that's not a thing. That's not okay to say, and it's not a thing.
No, absolutely. It's not okay to say such a thing. I mean, you know, it's like any other profession. You have to treat it, you know, a pet parent or anybody for that instance. I think you have to treat it. It's any other profession, whether I go to a vet. I mean, I'll give you my example. I have, since we have 3 kids now, 2 labs and an indie, and we have been to the same doctor. Because she's like the godmother to my eldest, and even though she's expensive, but we haven't switched because we have faith in her. And it's all about having faith in the vet, because we know it's a profession for her.
And I think I agree. It's definitely having, and I suppose that's what a bond is, you know, and it's having faith, because I think, and it's trust. It's having faith that your vet is there for you and for your pet, which I do believe that the majority of us out there that is our primary concern. I do believe, and I do hope that is the case, because certainly I've seen that. But it's gaining the trust of that client to believe that you do feel like that, because unfortunately, you know, and there's a gut reaction, isn't there? And I would always try and give a warning shot for clients, you know, like saying something, this could be expensive, because if there's a shock factor, like, I mean, God, I took my car for its MOT the other day, and I've got to find £1,000 to spend on it because it found a problem. And my mechanic did very much what I do, which is like, right, are you sitting down? And then I'm immediately like, oh no, but I trust him. And bless him, he then, I mean, not that I know anything about cars, but he was like, right, because basically the radiator's shot on my car, which is annoying, but I can't work without my car, so, okay, my emotional attachment, I mean, I do have an emotional attachment to my car because I, humanise everything, where I turn it into a pet. But my car's got a name. So, but it was a very similar thing that he did to me, is that he was like, right, I'm really, really sorry. I've got some bad news. I was like, right, okay, great. So there's my warning shot, and I would do that to somebody as well. Unfortunately, this is what we found. This is going to be expensive to fix. I can come and show you where it is on the car. And he's pointing at this like hole in the radiator, and I was a bit like, great. I don't even know what I'm looking at, but okay. And I will try and do that because I trust him. And yes. I would try and show clients where I can, and it's a way of bonding you. So I didn't even bother getting a quote from another garage.
Exactly.
Why would I? Because I trust him.
Yeah,
I would use him.
Yeah, that's where the whole thing comes, because I think with us, I mean, given the example of WED, because we have such a trust and the bond has been built, and the history is known of the animal. So it doesn't take much longer for her, for our doctor for our vet to even diagnose or analyze. And if she sees something wrong, she tells us, has this been happening? And is this what has happened? And it becomes much easier to have that conversation even with her.
Absolutely. Yeah, absolutely. And I think as well, I've had clients, I worked in the same practice for about 5 years, and there were clients that came to me and they'll say to me, oh, me, Ceri, I wouldn't worry about this. And I'm like, I do know that, I do know that. And I do know that if you're worried, then I'm worried. So it is, having that bond is really important, and it does help compliance or whatever you want to say, but it also helps because if that client is not a worrier, if they're then worried, then I should be worried. So it absolutely is, and that's what you get through time. That bond is something you get through time. It's having, it's humans, isn't it? It's really difficult to sort of pinpoint, but if you've got a bond with someone, and even if they get a new animal, that's fine because you've shared an experience with their old dog or cat or whatever, and you can be like, oh, do you remember when blah 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 did this but that is built with time. And I feel that me as a locum, I find that bit of my job really hard because I'm going into new practices, new clients, new pets, and you kind of like have to try and build that, try in 15 minutes to build a rapport, try and build a bond so that this person will trust you. And that, for me as a locum, I find that really hard. And the thing that says, I find that really hard. But and then I'm one of these locums that's like, oh, can you just like a week later, I sent an email to a practice I worked at for a week. I was like, can you just send an email to blah 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 because I just want to check in and see how it's going. A lot of locums don't do that. The good ones do.